Today's guest is a professional triathlete, Thomas Inigo. Thomas is a University of Virginia graduate, where he studied kinesiology and played collegiate soccer before transitioning into endurance sports. Less than a year after his first age group triathlon, he earned his professional triathlon card and has since gone on to race professionally while also coaching endurance athletes. Thomas and I actually met through the triathlon community before I ever became his physician. Later, he developed a proximal adductor tendon injury that significantly impacted his training and racing. I had the privilege to treat him with ultrasound-guided platelet-rich plasma, and today we're going to discuss his entire journey, from how the injury developed and why he chose PRP, to the rehabilitation process, and ultimately returning to professional triathlon competition. I hope you enjoy. All right, so welcome back to the Comeback Lab podcast. Today I'm excited to welcome Thomas, a professional triathlete. I had the privilege of treating his proximal adductor injury with platelet-rich plasma back in Colorado, where I did my fellowships. So, Thomas, tell the listener just a brief intro and kind of background into how you got into triathlon.
My name's Thomas Inigo. I'm a professional triathlete living in Boulder, Colorado. So I've only been racing triathlon since the beginning of 2023. And I got into the sport. I graduated from the University of Virginia in 2021, and was headed to physical therapy school to do my doctorate. But I actually got hit by a car, commuting to work on my bike. So I had to take almost a year off of any sort of activity completely. And of course, the first thing that I was cleared to do was swim. So that is how I kind of got in the pool for the first time. And like most, I hated every minute of it at the beginning because I was slow and it was hard. But really started to fall in love with it. Knew that I already loved running, so figured we should try and add the bike. And then I raced 2023 as an age grouper. Earned my professional license at 70.3 Augusta, and then started racing as a pro in 24 and moved out here to Boulder at the beginning of that year as well.
Amazing. You got your pro card pretty quickly after your race, which is good. Can you talk to the listeners a little bit more just about like your typical training schedule, like what that looks like hourly per week?
Yeah, for sure. The last 3 years have all been quite different. My first year of training, I think, I would maximum hours per week. It was probably 20-ish, if not a little bit more, maybe, but that would be like a big week. And then once I started racing pro, all the guys are so fast that it's a very different game. So you've got to start to train a little bit more and train harder for sure. So this year so far, I am kind of hovering in the high 20s to low 30s range, just in terms of actual moving time, across swim, bike, and run. And as I mentioned, the swim is my weak spot. So I swim 6 days a week usually. If I'm doing kind of a big swim block, I'll swim 7 maybe. But I normally have 6 swims, 6 bikes, and 5 runs. This is kind of my normal week.
Okay. Yeah, that's pretty high volume. I would love to get your perspective from elite athletes. Just how do you maintain that consistency and kind of what keeps you motivated and the ability to maintain that kind of volume of training week to week?
I think something that you hear a lot is, motivation isn't always there, but discipline is. So, like there are certainly times when it's like, man, I do not want to go to the pool. Like the last thing you want to do is hop in the water. And the motivation, not isn't necessarily there. And that's when, you have to really remember that one, we're privileged to do what we do, as pros, as elite athletes. It's not something that a lot of people get to do. So that's one thing that I always try to keep in the back of my mind is like, if I feel like I have to go do something, I think a good way to spin it is like, I actually get to go do this. It's not I have to go to the pool. It's that I get to go to the pool. I get to go run. I get to get on my bike. And I'm fortunate enough to call that my job. I think the other side of it is intrinsic motivation will always be stronger than something extrinsic. So, if you're motivating yourself with things that aren't personal, and don't come from inside you, that's something that isn't sustainable. So, you've got to have a lot of personal reasons to work this hard and to do what we do.
Mhm.
Um, if that car accident had gone differently, I may not be here. And I got hit hard enough and hit in a situation that if it had been a half a second different, that very well may have been it for me. So I feel like I've gotten a second chance. And that's not something that I want to waste.
Mhm. Yeah, I love that perspective. Thanks for sharing that. Um, so now let's dive in a little bit more to the injury story. Just tell us a little bit more about when did your adductor injury first start and what symptoms were you experiencing at the time?
Yeah, so it was the beginning of last year, and I was actually down in Cozumel for the first time ever doing the training camp with Next Gen, the team that I race for.
Mhm.
But ended up staying for longer than just the camp with one of my buddies down there. And it's really interesting because I just started to have some pain in my hip and almost like kind of up into my hamstring or like you know up into my glute, and I wasn't sure what it was. I thought maybe I strained my glute, maybe I strained my hamstring. So took about a week off completely and just tried to let it cool down. And that didn't seem to make a huge difference. Um, and at that point I was like, all right, well, let's see if we can just kind of work through it. So kept riding, kept swimming a lot, but didn't run because the run was too painful. And then just because of kind of the spot where I had the most pain, I wanted to rule out a hernia, a sports hernia. So I went and got an ultrasound. And the ultrasound tech was like, "Yeah, man, you're good. You don't have a hernia." And I was like, "Oh, sweet." He's like, "But your adductor's torn," which was just nuts.
Mhm.
Because I really was still riding pretty hard, swimming pretty hard, and I've torn muscles and tendons before, and I hadn't been able to work through that. So that was kind of the onset. And then I was getting ready to come home anyways, but that was a good moment to be like, all right, I need to get back so that I can really deal with this. Because obviously, a torn adductor is not something that you wanna kind of procrastinate,
Mhm.
starting the recovery process for.
Yeah. And so when did you realize it wasn't going away on its own? And was there anything that you tried initially treatment wise first?
Um, I took a week or a little bit more off.
Hmm.
Um, and when it didn't get better after that, that's a kind of a bigger red flag. It's like if you take 10 days off and it doesn't start to get better at least,
Hmm.
then it's like, okay, something more serious is going on here than just a strain. Um, I before getting the imaging done, I got dry needled. I, massage, just kind of all the standard, almost more physical therapy stuff.
Hmm.
And it did relieve some of the pain temporarily, but just the way that I was moving, it was still very clear that something wasn't right.
Yeah. And you were also having pain kind of even while swimming, right? When you were kicking?
Yeah,
Mhm.
kicking was really tough, and then I would feel it when I was coming off of a wall after doing a flip turn as well.
Mhm.
But maybe the most pain that I had swimming was after swimming with a buoy
Mm.
because keeping the like
Right.
adduction,
Mhm.
and keeping a buoy pinned between your legs like that, that's just activating your adductors
Mhm.
constantly. So I do a pull set and then take the put the buoy back up on the deck, and I would just have this pain and be like, "Oh man, that is
Mhm.
that is not good."
Right. Yeah. And so at that point, when you were starting to feel that, even swimming, and then you tried those other conservative measures, what do you think made you decide that the PRP made sense for you at the time?
Mm. It's one of those situations where maybe if you aren't racing professionally, that
Mhm.
you might have the time to let it heal naturally on its own, kind of run its course. So that was one side of it, is just I really wanted to speed up the recovery process as much as I safely could while still
Mhm.
respecting the injury. And then I'd also just heard from friends who had received PRP for some of their past injuries that it really helped speed up the process, and
Mhm.
they'd had a lot of good luck with it.
Yeah. So, yeah, what were your expectations when you were going into the procedure?
First of all, I think I probably like made it worse in my head because everyone was like, "Oh, dude, you're not gonna be able to walk for a week after the injection. Like it
Mhm,
hurts so bad." So
mhm,
I was definitely a little bit nervous, a little bit apprehensive, just of how much it was going to hurt in that moment, but also in the days following. So that was something that I was actually happily surprised by was
mhm,
that it's not a comfortable thing, especially given just the placement of the injection with the adductor very high up
mhm,
there. But it was definitely painful for a few days, but I was walking, I was moving, and that was not nearly as bad as I had made it in my head.
mhm,
Um, but other than that, really, just my hopes were kind of like I mentioned, just to speed up the healing process. And at that point, I was just trying to do everything that I could to get back to being able to be 100% healthy.
mhm. Yeah, and for you, in terms of timeline, you were pretty quick to jump on the injury with the PRP. A lot of times people come to me and they've been dealing with the issue like 6 months plus.
Yeah,
Um, but I think in your case, it was a really good idea because we know groin injuries, especially, can last a long time.
yeah.
And on average, in general, they take like 6 months to heal if you do nothing. So yeah, they're definitely not the kind of injury that you can come back immediately just with rest alone.
I really appreciated the conversation that we had when I
Hmm.
first came into the clinic because that's kind of what you let me know is
Hmm.
that, in reality, if I was going to be like ultra conservative and patient and just let it run its course,
Hmm.
I may not be able to train until like the very end of the year, seriously at
Right.
least.
Hmm.
Um, so that was definitely another point where I was like, you know what, if it's a good choice. I talked to my PT as
Hmm.
well to get her opinion. And she was like, yeah, I think, at the end of the day, if it'll speed up the injury process, then it's a 100% go for it.
Hmm. Yeah, and just for listeners too, for just to reference sort of the adductor area and give them an idea. So the adductor is our groin, and we have tendons that attach at the pubic bone, and so that's where the tendon issue was and where the partial tear was. But you mentioned how you also kind of had this vague sort of gluteal pain or pain
Hmm.
sort of in the hamstring as well. And so when we looked, we saw that the adductor magnus on the ischial tuberosity had some inflammation there too. And so it just goes to show you that you need to have a non-surgical orthopedic specialist that can kind of look at both areas and also have a complete picture and be
Yeah,
able to diagnose
100%.
that with ultrasound. Because I think that that was initially missed when you had the initial scan in Mexico before you came to see me.
Yeah.
So it's important, yeah, just to for those listening considering PRP, make sure that you get a good diagnostic scan with the sports medicine specialist so they can really know where to target the platelets because that's super important. Um, and then, yeah, your recovery, I don't remember being too bad, but can you just talk a little bit more about like the first week, what you felt?
I expected it to be much, much worse than it was.
Mhm,
Definitely like the day of the injection, I was quite sore.
mhm,
And then the 24 hours after, quite sore, but able to, be up and moving.
mhm,
I didn't train for a week, I think, just to really make sure that I honored the procedure, didn't force anything, didn't make anything mad.
mhm,
But then was able to ease back into riding. Able to ease back into the pool. I was using, like sim shorts.
mhm,
So I kind of had that floaty, um, the extra float, so I didn't have to kick, but without the buoy. So there was no forced add action there. And I was back in the pool pretty quickly as well. I started running on the lever, as, kind of a reintroductory walk run
mhm,
progression. And the lever was a great tool to have because, taking some of your body weight off running at a lighter percentage was really helpful. But I was happily surprised with just kind of my ability to continue to be up because I really have heard people say like you're gonna have to be in bed for a week.
mhm,
And that's where I was in my head. I was ready for that.
mhm,
So being able to just even be up and walking and getting to do some light activity was
mhm.
great.
Yeah, yeah. From what I remember, you were back on the bike pretty quick. I was pretty
Yeah.
impressed with your recovery overall. So, Yeah, can you talk a little bit more just about the rehab progression? And we can give a shout out to Kate Alexander
Oh,
too,
100%. Yeah.
is an amazing physical therapist out of Boulder who I got the pleasure to work with, and she's helped a couple of my athletes. So, yeah, just talk a little bit more about how that really helped in conjunction with the PRP.
Caitlin's the best. She's helped me through a lot of stuff. My back injury,
Mhm,
from the accident, the two biggest things. But uh, I mean, I think honestly, within a handful of days, I had gone into Hue Performance, which is her practice,
mhm,
and we kind of talked through a plan, kind of return to run timeline, return to full training timeline. But then, she also built out a program of pretty adductor specific rehab exercises that I was doing like 3 or 4 times a week. And a lot of those looked like, isometric holds to kind of put some load through that tendon in a safe way.
mhm,
And then, some stuff to also strengthen the musculature around the adductor. Um, um, when I did start to train again, all the musculature would be strong enough to handle the load. So your adductor, my adductor wouldn't have to, you know, um, be compensating for
mhm.
weak and failing musculature.
Right. Yeah. Yeah. A lot of runners get adductor injuries because of compensation from the pelvis elsewhere,
Yep.
particularly glute medius minimus weakness. So single leg stability is really important. And I remember she also had you doing a lot of that, which was good.
Yeah.
Mhm,
Yeah. Shame on me, but that's not something that I was doing a ton of before.
mhm,
But I mean, ton of stuff, single leg hip airplanes, single leg stance,
mhm,
like deadlifts, single leg RDLs, all this stuff, single leg balance taps, like pogo hops, all of this stuff, to really, like you said, just make sure that, glute med, glute min, everything is strong enough to
mhm.
keep the load out of that tendon.
Yeah. So, how did you approach returning to running and racing?
So return to run, like I mentioned, I did a walk run progression with the lever on the treadmill at first. Um, and I don't remember exactly how long I gave it after the injection, but a handful of weeks after the
Mhm,
injection before I even tried to start. Because I was like, you know what? If we're doing this, I want to respect it and I don't want to force it and, make things worse again. Um, but we did a pretty standard walk run progression. Um, with some weight off on the lever. And then we did the same progression on the treadmill without the lever. So full body weight, before I even started running outside again. So I almost did like 3 progressions of the walk run. So like lever, treadmill, just treadmill, and then walk run outside as well. So, we took it nice and slow. And it went relatively smoothly. There are always going to be the days that it hurts a little bit. But again, that's something that you told me to expect.
mhm,
And I think that, even outside of the immediate window after the injection, I remember, we had our like 2 month check-in or 4 month check-in, all that stuff.
mhm,
And, you know, I remember like going back and forth once in particular, and I was saying that I could almost feel it like starting to repair, which is an
mhm,
interesting sensation. Um, but like it was very like it really was palpable. And
mhm,
some days I would just get this like it wasn't pain, but it was almost just like there's definitely like a sensation in my adductor where I could tell
mhm.
that things were like happening. Um, and it as any injury progression, right? Like gets better and then kind of plateaus and then gets better. So, there was some lingering pain a little bit, but
Mhm.
all in all, it was like as close to linear going straight up as any injury I've ever had. So
Yeah. Yeah, you make some good points about the progression and kind of the up and downs. I always tell my patients to expect that, especially with tendons. We know that that's
yeah.
sort of how they heal. So, really important point there. Um, so, how do you feel now compared to before treatment? Are you feeling good?
So I came back to Boulder in March, I think that year, right? Um, Initially, my plan was to race Chattanooga before I even knew about the injury, so that didn't happen.
Mhm,
But then I actually did the swim leg of a relay here in Boulder for
mhm,
the 70.3 in June. And then by July, I was feeling ready to race again. So I did 70.3 Boise.
mhm.
Um, and, you know, like no pain all day, which was awesome. I mean, just to hit the finish line and, run pretty well off the bike, completely pain free was really great.
Mhm.
Um, so yeah, I mean, the rest of last year, I continued to do the stuff that Caitlin was telling me to do, continue to check in with you.
Mhm.
And then in November, I completed my first full Ironman. But at the end of the day, it was like, you know, 7 or 8 months
Mhm.
since getting the injection, and being able to, complete a 140.26 after that was awesome. Um, and then, yeah, I mean, ever since then, I had a great off season, um, and have raced 3 times already this year. So I've raced as much this year as I had last year, which is
Mhm.
awesome. Everything has felt very healthy, very strong. Um, don't have any, knock on wood, issues with the adductor. And my run is in a better place now than it was even before the injury.
Mhm.
I've put up two 115s off the bike this year, which is really exciting. And yeah, I mean, I'm training pretty hard. I was able to string a bunch of 50+ mile weeks together,
Mhm.
leading into the last 2 races. So volume is there. And it's an unfortunate way to find that weak spot. Like being injured is not the way that you want to like have to figure out that you're lacking in some way. But the injury definitely made me appreciate that I wasn't doing everything that I should be doing in terms of single leg stance stuff, loading stuff, force production, all of
Mhm.
that. So, you know, a hard lesson to learn, but the, the lessons that I've taken from it are now, I think, part of the reason why I've been able to build the run to where it is.
Mhm. Yeah, and what you're describing is exactly why I do what I do. So to be able to race, you got treated in April and then to be able to race by July, that's pretty darn good after an
Yeah.
adductor or partial tear. So I love to hear that. And then just to keep getting stronger and then to see you even run even better is just awesome. Um, so what would you say the biggest lesson learned from the injury was? Like, what would you summarize as the biggest lesson learned? And then any advice for athletes dealing with a similar injury?
Yeah, for sure. I think there are a couple lessons that I really, really kind of stuck with me.
Mhm.
Like I just mentioned, one of them is definitely that you don't want to wait until you're injured to be doing the stuff that will keep you from getting injured.
Mhm.
It's like most people only go and see their physical therapist when they're hurt. You should be doing PT all the time, as preventative treatment. Don't wait to get hurt to start doing stuff that will keep you from getting hurt.
Mhm.
Um, Another one is that it is really important to have a care team, and a group of people in your corner who you trust. But also, for athletes, it's important to have doctors and practitioners that understand sport. I mean, personally, I've had experiences with doctors where it's just so apparent that they have never treated athletes. They don't understand what athletes need. Um, and that is all too common. So, for everyone out there, if you do need treatment, just make sure that you are getting it from someone who knows kind of the world of sport that you were in. Because I think that's a really valuable thing.
Mhm.
Um, um, if you know something is wrong, don't put off talking to your practitioner, and looking for solutions, because 9 times out of 10, if you try to train through something, you're just going to make it worse. And I mean, I'm sure that was the case with me. Like, I'm sure that tear started as a micro tear and not something complete. And then I kept riding, I kept swimming, kept making it mad. And probably did that for over a month, honestly. And that kind of put me where I was. So, you know, find help, find treatment early and often.
Mhm. Yeah, those are all great points. And I love that you mentioned, try to find a doctor that's an athlete themselves. So I try to, practice what I preach in that way. I've also been injured and I've done triathlon, obviously, but also some other sports too. And I think it's just really helpful for me to have that perspective at what it takes to train at a high level as well.
Yeah,
Especially when
100%.
dealing
Yep.
with pro triathletes, especially, or any kind of pro athlete. I think it's really helpful. I was going to ask about some common mistakes athletes make when trying to return too soon.
It's a tough spot, right? Like, you obviously want to be back to training as quickly as you can be.
Mhm.
But the risk reward there is something that you really have to take into account. Um, you know, and I tell this to my athletes who I coach, but also just advice to family, whoever. It's like, you really have to ask yourself if it is worth it. And that is something that I have a hard time with. But it's something that this injury process helped me get better at, because after the injection, once it started to feel better, I was like, all right, I can like progress to run quicker than I had planned. And then take a step back and you're like, well, is adding whatever 10 minutes to this run really worth it? Like, is that really worth the risk of making it mad again? No. So I would just say, trust your practitioners, but also be real with yourself about, if you are actually feeling healthy enough and strong enough to like move faster than you anticipated, or if
Hmm.
that's just your ego or something else talking. Um,
Yeah, love that. You're giving some really good advice, so I hope that athletes will listen to this
I
if
hope
they're
so.
coming back from injury.
Hey, if I can keep even one person
Mhm.
from getting hurt or coming back too quickly, then it'll be a success.
What's next for you this season?
Yeah, I have Ironman Lake Placid in 3.5 weeks.
Oh, coming up
Yeah, it'll
quick.
be my first time in Placid.
Hmm.
Really excited. It's, kind of one of the legendary Ironmans. It's a pro series race, so the field will be quite big and quite fast. But I'm excited to have a good hit there.
Hmm. And where can listeners follow along with your journey?
Yeah, my primary platform is Instagram.
Hmm.
If you just look at my name, Thomas Indigo, it should come up. But if not, my handle is TMI does try, TRI. So that's where I post a lot of my training numbers, kind of day-to-day stuff from here in Boulder, and then obviously race content, and kind of what's next on the schedule.
Hmm. Awesome. Well, yeah, thanks so much for coming on the Comeback Lab. It was a pleasure to be your doctor, and thank you for sharing your journey. I'm so glad to see you back even stronger, and looking forward to see what you do at Lake Placid.
Yeah, thanks so much, Melanie. It's a pleasure to come and chat. Uh, Pleasure to chat with you always. It really was. That was a big turnaround point uh, in the year for me. I came back to Boulder injured and sad and just not able to do what I loved.
Hmm.
So super thankful to have been able to come get the treatment, and for the incredible results that it's had.
Hmm. Absolutely. Yeah, I was happy to help. So awesome. Thanks for sharing.
Yeah, of course.